Hi, I'm Chris Harper, and with me is Michaela, and we're here to demonstrate an application for hip flexor. Hip flexor pain can be muscular pain in front of the hip. Some causes of this may be kicking motions, overtraining, training on hills or stairs, or abrupt starts and stops. KT tape helps treat this condition by relaxing associated muscles, providing stability and support, and may increase circulation. For this application, we're going to actually just place a red dot to indicate where the pain may be. Your pain may vary slightly, but in this case, we're going to place this right in front of the hip. Okay, for our first part of this application, we're going to take a full strip. We're going to twist and tear the paper backing down by the logo to create an anchor point. We're going to be careful not to touch the adhesive on the tape as we apply that anchor point with absolutely zero stretch. We're going to peel that backing paper off, and we're going to apply this with 25% stretch. And for this, we're going to have Michaela lean back to put that area on stretch, so her skin is on stretch in front of the hip. We're going to stretch that piece out to 25%, applying that down, and then the last bit, we're just going to take off that paper and lay that last bit without any tension. Now in this case, we're taping over shorts. This is for demonstration purposes only. In reality, you'd be taping directly on your skin. Okay, for the next strip, very much like the first one, we're going to take a full strip, twist and tear the paper backing to create an anchor point. We're going to apply this just to the inside of that first piece. Again, applying that anchor with absolutely zero stretch. We're going to apply nice even pressure on that tape as we stretch that out to 25%. So 25% is if you stretch all the way out, back it off, 50% and 50% again. We're going to lay the last bit of that tape with absolutely zero stretch. We're going to give the whole thing a good friction rub. That friction creates heat, which allows that adhesive to stick to the skin very well. Okay, excellent. Here are some helpful tips before applying. Clean the skin very well, remove any skin oils or lotions. Be careful with taking clothing on or off, as this may roll the tape, and also trim hair in the area so you have a better adhesion of the tape directly to the skin. Some complementary treatments include rest, ice, anti-inflammatory medications such as ibuprofen, light stretching, and massage. Please seek care if you have severe pain or swelling, or if you have pain radiating into the abdomen or groin, or if you have difficulty walking. For more information, see our website at kttape.com.